Hello, my name is Lakshi Aldredge, and I'm a dermatology nurse practitioner practicing at the VA Portland Healthcare System. I'm delighted to speak with you today about the assessment and care of skin in patients who are either hospitalized or in care settings. Oftentimes, as nurses or other healthcare providers, we often are more focused on other important health systems, such as the heart or the lungs. And oftentimes, we put care of the skin or assessment of the skin in the background because we are so busy doing so many different types of assessments. The skin is the largest organ of the body and oftentimes is the first telltale sign that something is going wrong internally. So the assessment and care of the skin can provide the nurse or caregiver with a lot of valuable information about the health status of a patient. The skin presents in numerous manners. It can be dry, it can be moist, it can look very normal. And all skin is different. There are many different types of skin. There can be skin that tends to be thinner, especially in the frail elderly. And there can be skin that is thicker, especially in skin that is on the palms and soles of the feet, or skin that has been traumatized or thickened because of scratching or other trauma. So it's really important that when we assess skin, that we keep in mind that different areas of the body can present with different skin types and textures, and that because we live in a diverse world, different skin colors and skin tones can also make a difference in how we assess skin. I like to take the approach when I assess a patient with skin by first looking at their face as I introduce myself, tell them what my role is and what I will be doing for them, whether it's assessing their heart or lungs or doing a full assessment, or perhaps just talking to them about health promotion or other care needs. It's always an opportunity to check their skin. So starting with the face, you want to look at whether their skin is intact. That's the most important thing. The second thing that I think is really important is just to make sure, and you can tell this very easily as you're interviewing a patient or just sitting with them and talking with them in a room, whether the patient is literally comfortable in their own skin. Are they scratching? Are they picking at their skin? Are they rubbing their skin? Are they scooching around in their chair or on the bed, perhaps indicating that they're uncomfortable or their skin is irritated in some way? So without even thinking about it, you can glean a lot of information about the status of a patient's skin just by looking at them and watching their behavior. When I assess a patient's skin, we really want to start and do a head-to-toe skin examination. Sometimes that may not be ideal, especially if a patient is wheelchair bound or if a patient is unable to remove their clothing. So really trying to adapt your skin assessment to the needs of the patient or the specific unique characteristics of the patient are really important. So really just starting with looking at their hair, their head, and their face really can tell you a lot. Is the hair, which is also a part of our skin assessment, is the hair evenly distributed? Does it appear clean? Is there scaling? And then taking a look at the scalp and seeing, is the scalp intact? Is there flaking of the scalp? Are there open sores or erosions or scratches? That can tell you a lot about whether a patient has been scratching or picking. The other important aspect is to also look at the ears, behind the ears and inside the ears. That can tell you also a lot about the hygiene state. Remember that the ears, the hands, and the soles of the feet, the palms of the hands really have thicker skin, so it tends to be a little bit more durable, whereas skin on the face and on the tops of the hands may be more fragile because the skin is a little thinner there. Ideally, if a patient is hospitalized, performing a bed bath or changing the sheets might be an excellent opportunity to perhaps nonchalantly check the nature of the skin, especially the back. This is very important, especially for bed-bound patients or patients who are elderly and may not be able to be as mobile as other patients. So really being able to move them onto their side and doing a full assessment of their back. What you're checking for is, first of all, to ensure that the skin is intact and that there are no open sores or erosions or scratches. Another important thing to check for are signs of pressure. So if the skin is pink, red, purple, or discolored in any way, especially over bony prominences such as the hips or the buttocks. This is really important because that can tell you that the patient may be on their way to obtaining a pressure ulcer or perhaps a friction tear. It's also really important to check the neck area to make sure that there's no folds or areas of irritation. And also remember that the shoulders, we tend to focus on pressure sores below the waist, but oftentimes the shoulders and the back can be also areas where pressure areas can form. The other important areas to check are the extremities, the arms and the legs, making sure, again, that there are no pressure areas, for example, on the heels or on the elbows. Making sure that the skin is well moisturized, warm, and that there's good capillary refill. It's really important to check the skin color because oftentimes discoloration of the skin, especially in the distal extremities, the lower arms, the lower legs, where circulation may be poor, the skin may appear discolored, violaceous, pink, purple, even a dusky appearance. So skin color is a very important assessment of the skin. Another important measure of skin health is temperature of the skin. The skin should be warm to touch, but not hot. The cooler the skin is, again, especially in the distal extremities, may be an indication of poor circulation. So another thing that you want to assess is the temperature, the color, and the skin turgor, or the texture of the skin. By gently pinching the skin and releasing it, does the skin go back to its normal shape? This can be a sign of good hydration and that the skin is receiving adequate circulation. So you're assessing skin texture, you're assessing skin warmth, skin color, and you also want to check for moisturization. These are all key things. Another important area that is often missed in skin examinations, but is really critical, is the pubic area, the genital area, and the buttocks. And oftentimes, it just can be very difficult, especially for nurses and caregivers, because it requires disrobing or unclothing patients. Oftentimes, patients may have catheters in place, or they're concerned about awaking a patient. But this is really important to an examination that should be done at least every day, especially in patients who are hospitalized or in care facilities. You want to assess for any signs of urinary or fecal incontinence. You want to make sure that patients have good and appropriate hygiene in the genital area, and making sure that there are no signs of infection, perhaps from urine that or feces that are leaking. So you want to make sure that hygiene is appropriate, skin texture, color is appropriate, and then also if there's any malodorous situation, that can be an indication of infection or, again, poor hygiene, or that the patient is not receiving adequate care or hygiene practices on a daily basis. Another important aspect of assessing and caring for the skin is the type of temperature and environment, either in the home, in the hospital, or in a care facility. It's important that patients are in a comfortable environment that has adequate heat, ventilation, hygiene, and also that they have access to water to make sure that they're able to drink appropriate water and also wash and clean their skin. Different times of the year can have an impact on skin as well. We definitely know that in the summer, we hear a lot about sun protection and preventing skin burn. So it's really important to think about the temperature and the environment. So in the summer times and areas or environments or times of the year where your skin is exposed to hotter temperatures, it's really important that we adequately protect our skin. We used to think that using sunblock was the most appropriate way of protecting our skin from the damaging rays of the sun. But actually now we prefer that patients wear adequate clothing protection, such as long sleeves, long pants, and a wide-brimmed hat, especially if they're going to be spending significant amount of time in high sun temperatures. Ideally, selecting clothing that is loose, comfortable, and has built-in SPF factors really provides the best protection from the damaging rays of the sun. Most folks tend to wear baseball caps, but this does nothing to protect the sides of the face, the ears, and the neck, as well as the upper chest. And these are often the areas that receive the most damage from the sun and are areas that are at high risk for skin cancers. So it's really important that patients are educated to wear wide-brimmed hats or even hats that have the neck folds that protect the back of the neck. We also now, for example, in folks who like to fish or spend a lot of time in the sun, there are bandanas that can come up and protect half of the face, really providing extra protection from the sun. So in high sun times, such as the spring and the summer, this is a really important consideration. In colder temperatures or environments, the skin is still just as vulnerable. However, the concern is actually more about drying out the skin. It doesn't seem logical, but even in the times of the worst rain and the colder snow temperatures, this actually dries out the skin. So in the winter time or colder temperatures, it's really important to educate your patients about adequate moisturization. Ideally, we want our patients to apply a thick moisturizer immediately after getting out of the bath or shower. That really does help seal in the moisturization and helps protect the skin. It protects the skin from drying, but in elderly patients, it really does also help promote the elasticity and help prevent skin breakdown. It's important to educate our patients who are ambulatory and have a high degree of self-care. But skin assessment and education is also really important for our more fragile patients who may be hospitalized or in care facilities. These patients are especially vulnerable for skin disruption because they may be bedbound, wheelchair-bound, or have equipment that may cause skin restriction or decreased airflow to the areas of the skin. For example, patients who are in a bed-prone position oftentimes are on beds that may offer circulation or pressure alterations that move the patient from side to side. And this really does help decrease the incidence of pressure ulcers. However, the patients may have increased sweating as a result of being on beds continuously. So it's really important that those patients are assessed frequently, that their skin temperature and the condition of the skin, whether moisturization is present or sweating, is assessed frequently, and adequate measures are taken. For example, the application of lotions or even powders, which can help dry the skin and protect the skin from sweating. Another device that may be restrictive on patients' skin would be the compression stockings, which are very important in help promoting our patients' circulation in their legs. In fact, most of our elderly patients may have circulation problems, heart failure, or have chronic swelling of the legs for whatever reason. And we often prescribe compression stockings. These can be incredibly difficult for patients to don and take off. In fact, oftentimes they just put them on and leave them on because it is so difficult sometimes to put those on. So it's really important that we instruct patients to check their skin, take off those socks at nighttime when their legs are elevated. It's perfectly acceptable to take the compression stockings off then so that their skin can breathe. Electronic compression socks that are used in the hospital, especially after heart procedures or bypasses, also help promote circulation, but again can affect the skin integrity. So it's important that while those stockings are on or those compression devices are on, that you do take them off occasionally and just assess the skin to make sure that there's no points of pressure, that there's no sweating. And very rarely, patients can also develop a contact allergy to the latex or the material in those stockings or in those devices. Something as simple as leaving a blood pressure cuff on a patient to check serial blood pressures may cause irritation. So again, just be mindful that if you are keeping a device on a patient, that you check the skin frequently to make sure that there's no skin folds, skin pressure points, or skin tears, or skin irritant or allergic reactions that are occurring. An important factor in skin assessment, especially in patients who are in skilled care facilities or in the hospital setting, is to ensure that patients' feet and foot care is appropriate. Oftentimes, again, patients may wear socks or those little bed stockings that protect the skin when patients get up and walk around. It's important to remove the socks on a daily basis. Make sure you're checking the circulation of the feet, you're checking the skin color and temperature, and that you're also assessing for infection, such as fungal infections or toenail infections. You're also really checking to make sure that the patient has good pulses in the feet, and this is a good opportunity as you're checking the skin to also check the circulatory or vascularization of the patient. So you get two assessments for the price of one. Oftentimes, we have a healthcare team that helps take care of our patients in a healthcare setting. Oftentimes, we may have the RN, the LPN, the nursing assistant, as well as the physician and other team members who are caring for a patient. Typically, one of the things that used to be assigned as a nursing duty was bed baths. And fortunately now, we have larger team members who can help assess patients and take care of some of those perhaps non-nursing functions. Nursing assistants play an important role in assessing skin, especially when they are doing bed baths. This is an ideal opportunity to not only provide hygiene for the patient, but this is a key time to do a good skin assessment. So all members of the care team are responsible for the skin assessment and health of the patient, including nursing assistants, physical therapists as they're working with patients in their mobility, occupational therapists, and definitely all different nursing types as well. As I mentioned, the skin can often be the first sign that something systemically is not going well with the patient. So skin assessment really provides us with a lot of important clues. So what are some of the clues? First of all, if you notice that the hair is thinning or falling out, for example, when you move the patient in the bed or you change the pillowcase, you notice that there's a lot of hair or a few strands of hair that you would normally not expect, and that there's diffuse thinning of the hair. That can be a sign of thyroid disorder, nutritional dysfunction, or poor cardiac health even. So that can be a sign. Checking the hair and the distribution of the hair, not only on the scalp, eyebrows, eyelashes, axillary and pubic areas, as well as hair on the legs and on the arms. You want to see nice even distribution, and you don't want to see shedding in the sheets or on the pillowcases. So loss of hair unexpectedly can be a sign of stress, infection, poor nutrition, or even thyroid or endocrine disorders. Oftentimes, sudden shedding of hair can be the result of an infection or a stressful period that occurred even 3 or 6 months prior because of the different stages of hair growth. So hair assessment is really important. Assessing the nails is also important and can be a clue to different disorders that are occurring systemically. For example, if you have pitting or oil spots on the nail, that can be an indication of autoimmune conditions such as psoriasis or thyroid disorders or even lupus. Other issues with the nails, such as discoloration, white or yellow nails, or even clubbing of the nails, can be indication of pulmonary disorders and even cardiac insufficiency. Of course, if you have poor skin turgor, skin color, or vascularization issues, you will see discoloration of the skin, purplish, bluish, cool temperatures of the skin, especially again in the distal extremities, can be a sign that there's vascular compromise or poor cardiac health. Edema or swelling of the legs can also be a sign of heart failure or cardiac dysfunction. If you have unilateral swelling of a limb, that can also be an indication of poor lymph drainage and lymph blockage. So that's something to also keep in mind. This is especially important after a specific procedure has been done. For example, a lymph node biopsy or a knee replacement or a unilateral procedure. Important to check for swelling. It's also really important to look for moles and check for any ugly duckling signs. And those are moles that may appear discolored or multicolored, who have asymmetric borders or irregular borders that are suddenly growing or changing, or may even be bleeding. So oftentimes I'll see a patient and I'll notice a mole that meets the A, B, C, D, E criteria: asymmetric, irregular borders, multiple colors, growing or changing diameter, and E is evolving in any way. So I may ask a patient, has this mole always looked this way? Has it been changing? Have you noticed when you look in the mirror that your eye goes to that mole? That can be a worrisome sign. And of course, with moles, the most worrisome thing we worry about is melanoma. And melanoma is one of those scary cancers that oftentimes presents first in the skin, but also can spread very rapidly. And actually, sometimes we have patients who have systemic or metastatic melanoma, and we never see an irregular mole. There are obviously other types of skin cancers. So if we see lesions that appear roughened or hyperkeratotic, which means that they have skin cells that are growing on top that make them look rough and white, that can be a sign of a squamous cell carcinoma, which is the second most common type of skin cancer. If you have a skin lesion that looks pink or shiny or pearly and is easily bleeding, that can be a sign of the most common type of skin cancer called basal cell carcinoma. So it's important as we're doing our skin assessments and checking for color, temperature, signs of skin disruption, that we're also looking for moles and also looking for any bruising, which can also be a sign of circulation disorder. So looking for any unusual areas of discoloration, irregular spots on the skin, or new or changing or bleeding lesions, this can be an indication of a malignancy or a skin cancer. Really important to have a dermatology provider check that out and perhaps even biopsy it. An important aspect of skin function is itch. This is probably one of the number one complaints in patients, especially in care facilities or hospitalized, because first of all, they're out of their environment and they may not have their regular skin routine that prevents itching. So itching can be an incredibly emotional and physically disabling condition. We're talking about localized itching, perhaps in one spot, but also diffuse itching, which is called pruritus. Diffuse, widespread pruritus can be absolutely disabling for a patient. Sometimes the cause of the itching can be very difficult to discern. Especially in elderly patients, renal dysfunction or liver dysfunction can be one of the primary reasons that patients itch, especially patients who have chronic kidney disease or chronic liver disorders. So if you have a patient who is complaining that they are constantly itching, it's really important. The first thing to do, of course, is to check the skin to see if they have dry skin. Dry skin is the number one reason why patients itch. So it's really important, especially in elderly patients who have more water loss, that their skin is almost overly moisturized in order to keep that skin turgor and that skin moisturization to help prevent the dryness or xerosis that's the number one cause of itching. Another important aspect of itching is to look for infestation. This is also, unfortunately, an important factor in skilled care facilities or in hospitals even. And when I say infestation, I mean scabies or lice, body lice, hair lice. So it's really important if you have patients who are chronically itchy and who may have little open sores or little red dots or scratch signs, especially between the web spaces of the fingers, in the genital area, or all over. This is important to check or assess for scabies, and this is done with a scraping, so call your dermatology provider. And also ask, do they have housemates or family members who are also itching? Because again, this is a very contagious condition. It's also really important with itch to make sure that this is not a reaction to medications that they may be taking. So especially our elderly patients are on numerous medications, and oftentimes these medications get changed, and our body doesn't react well with that. And some of the first ways our body tells us that it doesn't like a medication is by causing itch. So when patients are complaining of a new itch, it's important to ask them if they've started any new prescription or over-the-counter medications, and also asking if they've taken any new vitamins or herbs. Have they eaten any unusual foods? Have they tried any new lotions, switched soaps or detergents, even new clothing or sheets? All of these can cause sensitivity reactions resulting in itch. One of the best things about healthcare in the United States is that patients are living longer, and this is a blessing for us. However, this does cause other issues as well. We want to make sure that as we are living longer, that we're able to take care of ourselves. And hopefully, patients are practicing wellness practices that are keeping them more mobile and are able to take care of themselves as they age. But for many patients, they're unable to do this. That, along with the inability for family members perhaps to care for patients at home, and the declining access to healthcare workers in skilled care facilities, patients are relying more and more on alternative ways of taking care of themselves as well as their skin. So it's really important that we give patients tools and education to help them self-care for their skin. Again, the education to moisturize their skin first and foremost. We can do that by giving them adaptive devices, especially if they can't reach their back or even their legs. So there are tools and equipment, back applicator pads that allow them to put lotions and creams on a device and then be able to reach in hard to reach areas so that they can apply medications, ointments, creams, and lotions easier. Also, making sure that patients have adaptive equipment in bathtubs and in showers so that it is easy for them to go in and do and perform appropriate hygiene on a daily basis so that their skin is not getting infected or having complications from poor hygiene. So anything we can do to get home assessments for adaptive equipment, and oftentimes these are funded by insurance or Medicare or Medicaid. So having those adaptive devices in their homes or in their care settings so that it makes it easier for them to be able to practice good hygiene is one of the most important things in maintaining good skin care. And remember, a large part of the US population has diabetes, and diabetes makes us prone to skin issues. This can be because of peripheral neuropathy or loss of sensation, especially in the feet. And this can cause numerous health problems. It can limit their ability to walk or exercise. It can cause patients to trip or fall because they're unable to feel or sense where their feet are. And most importantly, especially if they're walking around barefoot and they're able to not feel if they step on, say, a pebble or they get a little splinter, that can cause a sore on the bottom of their foot. They may not even realize it because they're not looking at the bottom of their foot or they can't. And subsequently, they start developing an infection. And especially in our diabetic patients, this can lead to complications, including loss of toes and amputation of the feet. So really educating our vulnerable elderly patients, especially those with diabetes or peripheral neuropathy or other sensory issues, that they really need to be checking their feet, wearing socks and shoes, and trying, even though they may not be as ambulatory, trying to exercise as much as possible. And that's another great thing that we can do is offer them devices such as stationary bicycles or just the pedals so that they can remain active but do so in a safe manner. This really does help promote our elderly who are living longer to maintain a quality health status, thereby ensuring that their overall health is well maintained, and subsequently they maintain a good skin health as well. The COVID pandemic does provide a unique opportunity to assess the skin for signs and symptoms of a new infection. COVID can manifest itself in numerous ways in the skin. The most common presentation has been with discoloration or purplish pinkish spots in the distal extremities, the toes, the fingers, but primarily in the feet and the hands, but it can certainly occur in all the extremities and throughout the skin. So it's important that as you're looking at the patient's skin, if you notice a new rash, especially presenting with purplish pinkish spots, you need to think about COVID as a potential infectious etiology for this new rash. Other infections can also present this way. It can be caused by cold disorders and circulation. This is called pernio. Or it can also be caused by calciphylaxis, or little points of calcium that block the blood vessels, causing that purplish red spot. Other infections that may cause a similar type of rash include measles, meningococcal infection, and also syphilis, which unfortunately is still alive and well in our communities. So anytime you see a patient with a new rash, things that you should be thinking about are COVID, an infection such as measles or meningococcal disease, and also circulatory disorders or even medication reactions. If you have a patient who has symptoms of COVID, including upper respiratory infections or upper respiratory symptoms such as sore throat, cough, shortness of breath, or they have tested positive for COVID, it's important that you do a full skin assessment to ensure that there are no rashes associated with the COVID infection. It's incredibly important to acknowledge the role of all healthcare providers, but especially our nurses and our LPNs, MAs, nursing assistants, and all members of the healthcare team. What you do every day is so important in the care and the health of our population. And we know that you are so busy and have so many demands on your day. Taking the time to assess your patient's skin health will do them the world of good and help prevent problems down the road. So I really want to offer my sincere thanks for all that you do in taking care of your patients. We know that the health of the U.S. population is in your hands, literally. So thank you so much for taking the time to listen to this session. And please reach out to the Dermatology Nurses Association, the Society of Dermatology Nurse Practitioners, and numerous other organizations such as the National Psoriasis Foundation and the National Eczema Association that have a myriad of resources to provide you with ongoing education and resources to help you better prepare to take care of your patients and maintain their skin health. Take care.